For the case study on Andrew, he's an adult, most likely in his mid-20s. He was diagnosed with GBS on August 1st of 2016. Some precautions for GBS include you don't want to cause overexertion. You want to beware of skin breakdown. You need to attend to posture and positioning, and anxiety is another thing to look out for. Andrew recently went to EMT school and was a new firefighter when his symptoms first started. He enjoys working out or doing CrossFit and playing guitar or ukulele. His roles include being a son and a boyfriend. He was independent in all tasks prior to onset of his GBS symptoms. Client's goals are to return to the level of function he was at prior to his condition. Andrew has a strong support system, including his parents and girlfriend, which motivate him as well. And he's also motivated to improve as it increases his independence in the tasks that he does every day. Moving on to the intervention planning tool. So GBS is an inflammatory disease of peripheral nerves. Its etiology is unclear, but enteritis proceeds in about 41% of cases. About 90% of individuals diagnosed with GBS recover completely within 2 years, while about 10% die from respiratory paralysis. Precautions, as I mentioned before, include you don't want to cause overexertion, beware of skin breakdown, attend to posture and position, and anxiety. Some strengths for Andrew in this case include he has a strong support system, including his parents and girlfriend, and he also has motivating factors such as returning to work as a firefighter and being able to work out again since he was very active in that. And another strength would be his young age. For potential for improvement is very good. As I said, 90% of GBS cases fully recover. The frequency I'd want to see him is 3 times a week for 12 weeks. And some discharge recommendations would include I would want him to be independent with his home program, independent with self-care ADLs, independent or at least modified independent with ambulation, and we would need to remind him again not to overwork or overexert himself, as we don't want him to regress. The first problem I chose to address was his decreased upper extremity strength, which impacts his independence and participation in ADLs and IADLs. This is important to address as it impacts his ability to participate in many different ADL and IADL tasks, which can be difficult if you don't have the upper extremity strength. So his long-term goal addressing this would be client will perform upper body dressing while seated independently by discharge. And the short-term goal to go with it is client will demonstrate knowledge of home education program to improve strength and endurance in bilateral upper extremity within 4 treatment sessions. This would be an education type intervention, as the client will learn HEP that will help increase strength and endurance needed to perform ADL and IADL tasks, and it could be seen as preparatory methods, as client will demonstrate that they are properly performing HEP exercises before moving on to another task. We want to improve this as it'll increase his participation, independence, in functional tasks. It'll also allow him to start preparing to return to his interests, such as working out, and return to work as a firefighter, as he'll need that strength there. So one way to upgrade this is increasing the home exercise programs for the client to have him perform full body dressing instead of just upper body dressing, have him perform the full body and while standing. And then a downgrade could be providing a checklist for his home education program or incorporating the use of adaptive equipment while dressing, such as a dressing stick. This was based off of the biomechanical frame of reference and would be considered an established restore approach. Moving on to the second problem, I chose to address his deficits in mobility, which also impact independence and participation in ambulation and just moving about when completing ADLs and IADLs. This is important to address as it impacts the client's overall independence and could be very discouraging if prior to their injury or onset of symptoms they were completely independent in ambulation and now they're reliant on someone. So a long-term goal to go with this is client will ambulate 30 feet independently by discharge, and the short-term goal to go with it is client will stand for 3 minutes at sync to perform morning ADLs independently with no rest breaks within 8 treatment sessions. This is an occupation-based intervention as the client will participate in morning ADLs, which include brushing teeth and washing face. Client will first perform these tasks with walker, with CGA, and slowly increase the time without. So we want to wean him off of it. We're doing this to increase his independence in mobility, which will increase overall independence in all of his daily tasks. One way to grade this activity up is by incorporating more ADLs to be performed while standing at the sink, such as grooving. So we could have him shave or trim his facial hair at the sink after he's brushed his teeth and washed his face. And a way to downgrade this would be to allow him to perform the activities at the sink seated at first. This is also based off of the biomechanical frame of reference and is also another establish, restore intervention type. Moving on to the last problem I chose to address was his mental health, specifically anxiety, which can have an impact on a client's ability to participate in therapy sessions. So again, this is important to address as psychosocial problems can impact outcomes of therapy. It has the potential to hinder therapy progress and can also impact a client's ability to perform their daily tasks. The long-term goal I created for this was client will identify and perform 5 coping strategies for anxious thoughts to improve mood and increase participation in ADL, IADL tasks by discharge. The short-term goal is client will identify 3 personal triggers for anxious thoughts to increase awareness within 5 treatment sessions. So this is an education type intervention as the client will learn triggers of anxious thoughts and will identify ones that are personal triggers for him. And the client will also learn different healthy strategies to redirect or cope with anxious thoughts and figure out which ones work best for him. This is important to educate the client on identification of strategies and coping with anxiety as it improves their awareness and overall mood, and sometimes they're engaging in unhealthy coping strategies, so we want to make sure that they're engaging in healthy ones. A way to grade this activity up is to have the client independently research these coping strategies versus providing them with a list. And a way to grade this down is to have them identify 3 healthy coping strategies instead of 5 because they may only find 3 that work for them. This would be based off of the cognitive model, and this is a prevention type approach.